We are live.
There we go. All right. I'm on video. Good to
Yes.
go. I think.
You're
Don't go
on.
too far. What time is it?
It's time that we start
All right.
the roll call.
Okay. Good evening, everyone. And welcome to our Passaic County Board of County Commissioners meeting for April 13th, 2021. May I have a roll call, Mr. Imhoff?
County Commissioners Apter. Here. Bartlett. Best. Duffy. Lazara.
Here.
Deputy Director James.
Here,
Director Lapore.
Here. Lou, I think you're muted.
I am not.
Lou wasn't muted, Pat. The TJ's muted, and I think John Bartlett was muted, but he's not now. I don't know.
Can you hear me now, Lapore?
I can hear you from the hallway.
That's director.
We'll take care of the issue in 1 second. It's a technical issue on the machine.
But everybody else can hear me,
Yeah.
right?
Yes.
Yes.
I can't hear him.
Can you hear me, Pat?
Want to get in?
Yes.
Maybe Pat can't hear anyone.
Yeah, it's a technical issue on his PC. We'll have it fixed in the next few seconds.
Turn up the volume.
Oh, good.
They couldn't hear me either.
Can hear you, actually.
I can hear every.
I can hear Brian now.
Yeah. He says he can hear Brian now, so. Lou, when Pat gets on, see if he can hear you.
Yep. Pat, can you hear me now?
Yes, I can.
Okay, and we can hear you.
Good. A little technical difficulty. Apologize for that. All right, we did the roll call. Announcement of the open public meeting law, please.
Ladies and gentlemen, the notice requirement of the open public meetings law has been satisfied with respect to this meeting, specifying the time, date, and location, including the annual notice adopted at the reorganization meeting, filed with the county clerk, posted in the administration building, and mailed to 2 newspapers in accordance with the provisions of the law.
Please stand for the invocation.
O God, who provides for thy people by thy power and rules over them in love, be gracious enough to bless thy servants, our county commissioners in the county of Passaic, that thy people may dwell in peace and safety through our Lord. Amen.
Commissioner Duffy, the Pledge of Allegiance, please.
Pleasure, Director. I pledge allegiance to the
To the
flag
flag of the United
of the United
States of
States of
America
America,
and to the republic for which it stands,
one
one
nation,
nation, under God, indivisible, with liberty and justice for all.
Thank you, Director.
Please stand for a moment of silence. Remain standing to remember the men and women who have died while serving the United States Armed Forces. Also, if we can also include those in the military who have died from COVID-19, and also especially the 1,600 plus residents from Passaic County who succumbed to COVID-19. Thank you. Okay. Have a motion for the approval of minutes for March 23rd,
I will make that
2021.
motion. Commissioner Duffy.
Motion made by Commissioner Duffy,
Second.
second by, is that Commissioner
Bartlett.
James?
Bartlett.
Oh, Commissioner Bartlett. Roll call?
County Commissioners Apter,
Yes.
Bartlett,
Yes.
Best,
Yes.
Duffy,
Yes.
Lazara,
yes,
Deputy Director James,
Yes,
Director Lapore,
Yes. Have a motion to approval of the proclamations,
I'll move it.
moved by Commissioner Lazara,
I'll second it.
second by Deputy Director James. Any discussion? Roll call?
County Commissioners Apter,
Yes.
Bartlett,
Yes.
Best,
Yes.
Duffy,
Yes.
Lazara,
Yes,
Deputy Director James,
Yes,
Director Lapore.
Yes. Mr. DeNova, your administrator's report?
Thank you, Director. I have two things on my agenda this evening. The first, as you can see, we have Dr. Al Lindeman here with us from Janus Solutions. He's going to talk to us about the upcoming rental assistance program. As you all are aware, the county received almost $15 million in a grant to help people stay in their homes during the COVID pandemic. I think as you'll see, as Dr. Lindeman goes through his presentation, that what's going to set Passaic County apart from other counties is a real holistic approach in trying to help people stay in their home. So I don't want to step on his presentation, but I'll turn it over to Dr. Lindeman now to discuss the program and how it's going to work here in the county of Passaic. Dr. Lindeman, you're on mute.
Hard to talk on mute. Thank you, Mr. DeNova.
It's easy to talk on mute. It's harder to hear you on mute.
Yeah, it's tough. Mike, I assume you've got the PowerPoint ready to go. Here we go. Good evening, everyone. Thank you for the opportunity to share with you a bit of the initiative that is coming forth, the Housing Security Initiative, with a comprehensive rental assistance and wraparound services. I'll talk a little bit about the wraparound services here in just a minute. Just to set the context for you all, in 2020, Janus Solutions had the opportunity, Personally Associates and Janus Solutions had the opportunity to lead a needs assessment in Passaic County. It was engaged by residents at a very high rate, probably 2,650 total individuals that were interacted with in one form or another, a lot of deeper conversations as well. And so growing out of that, some recommendations when we presented to you all on September 22nd was that there be a collective impact council set up, as well as moving to, we also recommended a particular task force, the homelessness and housing task force. And so that's a bit of a setting for where we are today. And Mike, if you want to go ahead and move to the next slide. So while we were talking with people for the needs assessment, we recognized that a lot of people were scared. There are people who had lost jobs during the pandemic that we interacted with. They were going to need either new jobs or new career paths, support of some sort. And of course, as the pandemic stretched on, their rental arrears became quite an issue for a number. And so as you all supported the establishment of a Passaic County Collective Impact Council, that body is set in motion. It's about 45 individuals from varied sectors across the county including a couple of the commissioners that are here and a handful of individuals from the county, Mr. DeNova and others, that are key stakeholders from across the county to try to work in a different way, in a collective impact way, so that we address some of these significant needs in the county in a collective way, letting the right hand know what the left hand is doing, filling gaps where we can, and finding strategies that both short-term and long-term that can address some of the significant issues. So we rebranded the Passaic County Collective Impact as Impact Passaic. And many of you have seen the logo, but some of you perhaps are seeing this for the first time. So there's our Impact Passaic logo that we're now working with. And the task forces that are formed, you see listed there, the housing and homelessness, we formed that right away after, as we got into October. That group has been meeting for several months now. The network is stronger and tighter than it's ever been. Some of the gaps in the flow of social services for those facing homelessness have been filled and shorn up. We also began a behavioral health task force 2 months ago. That task force has now met a couple of times and is bringing forth some recommendations, perhaps by the next commissioner meeting. You see the third one listed there, the Eviction Prevention Initiative Committee. And that's a group that was formed about 2 months ago. Commissioner Bartlett, a handful of others. In fact, why don't we go ahead and go to the next slide, Mike? And I think it shows, it talks a little bit about the need. So before I get into exactly what that task force is doing, because it's relevant to this program, let's set the stage of the Emergency Rental Assistance Program. 14.9 million in federal funding. There are additional funds that have gone to the city of Patterson, and the state of New Jersey also has some rental relief funds available. These funds are designed to assist households, of course, that are unable to pay rent and utilities, and it comes directly due to the COVID-19 pandemic. So we have some funds that we have pulled together from a number of sources to provide other housing stability services, a holistic wraparound approach, which you'll see here a little more in a second. So, of course, our goal is to keep families in their home, and applications can be made by either an eligible household or by a landlord, or on behalf of an eligible household. And I should say as well, for some individuals who perhaps will struggle with either language issues or an ability to use online services, we will also make it available for representatives of those individuals to assist in applying. Next slide, please, Mike. So eligible households for this, people have to have had a reduction in household income or have experienced financial hardship due to the pandemic. They need to demonstrate a risk of homelessness or housing instability. Now, according to the guidelines from the U.S. Treasury, the individuals who are eligible to receive this are those who are at 80% or below of the area median income. And so you see that for Passaic County is $78,500 for a family of 4. For an individual, it's around $50,000. We are giving priority to households at or below 50% of area median income. And we're going to prioritize households with children, smaller mom and pop landlords, and disability affected households, as well as seniors. And then we're working with the court system again with the next slide. I think it may list a little more about this, and I'll tell you about how we're approaching the eligibility. We hope there's enough money for everyone up to 80% of area median income, but we're going to start with 50% or below and prioritize what you see. Next slide, please. So with our approach, we're going to have a secure, user-friendly application process. The county has contracted with Solix, a firm that has done this kind of work in previous programs that have been government aid, and they have a very good track record. They've got excellent recommendations from other counties who have used them in programs. And so we are going to add to the application screening questions to identify households with additional needs, part of our holistic program. We want to make sure and not only provide rental relief, but also if we can keep people stable in their homes, and if they need additional support services in order to keep their feet on the ground, we want to make sure and provide that. This approach, we have already talked with our providers across the county. We are coordinating all relevant providers of service, and our goal, again, is we're putting Passaic County residents at the center. Next slide, please, Mike. You see the number of cases that have been filed thus far, and that's a little bit of an older number. I think the cases are now over 5,000, where landlords have filed for eviction. That represents at least 35 million in rental arrears at fair market values. And you see the top municipalities by number of defendants. Next slide, please. Before I go through this, would you mind backing up, Mike? Is that okay? Is that easy to do? All right, I want to speak here again. I mentioned this eviction prevention task force that's been working. So Commissioner Bartlett, Judge Adam Jacobs, who is the only judge that at this point has been assigned to the eviction docket. We've had a lawyer who represents at least half of the corporate landlords, Nestor Guzman, on this group. Northeast Legal has been on it. Karen Corsi, who is the Passaic County Bar Association president, representatives from the Department of Human Services for the county. And we've been working very, very hard and very closely. And I just want to commend the group. I mean, you know, Commissioner Bartlett, lots of time, and I'm not just singling him out. The whole group has been outstanding in how they've worked. They've found out information. We have gone through a lot to determine who our priorities are. You saw a slide a minute ago that talked about moms and pops, and we have set aside 3.5 million for moms and pops. Now, just to give you an idea, you see the 4,876 cases. 90% of those are corporate landlords. Only 10% of those are moms and pops. And we assume that's because lots of moms and pops don't know how to do this. They've never done it before. They're in trouble themselves. They need help, and they're just waiting to see what happens so they can get some help. So that's why we set aside what we feel is a fair distribution of funds for moms and pops and for the corporate landlords. So what is a resident going to do? So next slide, please, Mike. What is a resident to do? If one of our residents or landlords has a need, you see at the top, do they have internet access or not? And I'm assuming most of our landlords will, but perhaps even a few do not. Certainly some of our residents do not, who need help. So if they do not, there are community-based organizations and faith-based organizations that are ready to help them get connected and get the support they need. So once that happens, whether the individual themselves has internet access and they go to the left to the county website, other online databases and municipal websites that bring them to the link to apply, you see in the middle, the larger box in the middle, our clearinghouse, the emergency rental assistance vendor, which is Solix. And so one way or another, our resident will be brought to that clearinghouse. And by the way, they can do this by phone potentially, and it's multilingual in terms of phone support. We do know, however, and just to mention that because of our cultural linguistic communities in our county, some of our residents are going to need assistance from their local community resources. And so they will go to community-based organizations, and we're going to help fund that process to get people so they can get to this clearinghouse. So once they go through the clearinghouse, you see on to the left, there is a service navigator. We are bringing on a service navigator who is going to be almost the air traffic controller. They're going to help place people towards case management. So you see care management there, and you can also interpret that as case management. We're going to get individuals who need additional help from rental arrears in a holistic way to services to support them. All the services you see in that box on the right of this, this figure. And the goal, of course, is ultimately through this process to bring people to where they're housing secure. Next slide. We know moving ahead, we're going to have to do some extensive marketing. We are in process of planning all of that. We expect to go live by the end of this month. We will firm up that date, we believe, this Thursday. At least by the end of this week, we should have an exact date, and we will let you know as immediately. Next slide, please. So this has been a brief overview of our holistic collective impact approach to addressing the needs of our residents beyond just their rental relief needs, serving landlords, serving residents who have need, and providing those wraparound services that you saw in that previous slide in that box to make sure if people need additional training or they need they need some sorts of support, perhaps even utility payment, other things to keep them on their feet, even for 2 or 3 months. We want to be there with case management to support them in moving forward. So I'll stop. How can you help? As much as anything, be champions for this. Pass on the information to anybody and everybody that you can. Beyond that, are there any questions or any discussion?
If I may, the chair, Pat's muted.
No, I'm not.
All right. So, I've been, Albert, I've been following this all along. I am thrilled with what I just saw. I really am. The wraparound services was really well thought out, and it hits almost every bit of help that the county can muster to offer people. It's really a good job. It really is. And I think the company that our administrator appointed is actually the right company to do this. I'm thrilled. This is my passion, and you've met the needs, and we'll see how it works out. But I think that we have the best shot at doing exactly what we wanted to do. So good job. Really.
Thank you.
Good job. Really.
Thank you. And just to add briefly, within our cultural linguistic communities, I mentioned the case management that we're adding to help individuals in those communities. Another way to look at with those case managers think of them as navigators. Some of our residents who culturally, linguistically, not from the United States, don't know how to navigate, and we are going to support navigators helping those residents. Just want to clarify that.
Albert, as Tyler Ford, I have a question. It seems like a very, very bold and ambitious plan you put together here. And done right, it's going to help a hell of a lot of people. The administrative costs, have you put a number on that?
Yeah, so of the 14.9 million we've received, 10% of that is from the U.S. Treasury, they say, should be used for administration. So that is 1.49 million for administration. Of that money, Solix is going to be in the $900,000 category for their charges. And the potential is it may be less, but the additional $500,000 is part of the wraparound funds. We as well have some CDBG money that comes from our Economic Development Office, some funds of $700,000 to help in the wraparound services. So right there is a minimum of about 1.2 million. And everything I laid out for you, including the legal service support that's going to be needed. As you can imagine, there's going to be a lot of, we have a plan as to how we believe we can handle most of the court cases. And we think it's going to result in, and you know, this is a guess, Commissioner Bartlett, you may correct me if, you know, if you have a different thought about this, but we think what we want to offer to all of those who are in eviction court is a settlement that's going to take care of 80% of them, maybe 90%. But for those that are left, there's going to be need for some legal assistance and services to help mediate, negotiate between landlord and tenants. And so some of our funds are going towards that as well. So at this point, in the low million to $1.5 million, we also believe there's more money coming for emergency rental relief with a second wave that has not yet been assigned from what President Biden and the Congress moved through as of about 3 weeks ago.
That's good. One more question. In view of what's going on today with the vaccines, the resistance to them, and all that goes with that, as far as the homeless population goes, is there a level of resistance among the population for one reason or another?
To this point, I have not heard that there is extra resistance from the homeless population any more or less than society as a whole. Don't hold me to that as a guarantee. That's my sense to now, but I don't have a full answer. We have not brought the vaccines to all the homeless yet, although many have now received vaccines. But I don't know if, perhaps Dr. Gungil knows if there's been more resistance or not, but actually I'm not sure Dr. Gungil necessarily knows what the agencies who are working with the homeless know. And from what I've heard from them, I've not heard any additional resistance from homelessness, but that's a preliminary response.
And do you have an estimate as to the homeless population in Passaic County?
Very difficult to count. There's no question about it. The numbers are, I think in this point in time count that was done 2 months ago in the maybe the 450 range. We actually believe there's quite a bit more that doesn't get counted because they don't quite meet the HUD definition. For example, the McKinney-Vento liaisons in our schools in Passaic County can tell you how numbers and numbers of families that they know go from place to place to place. Sometimes they stay in their car in the park and the kids are there. Sometimes they're at relatives and they don't get counted as homeless, but they actually are. And that number could be in the several hundred more.
All right, thank you very much.
Albert, you mentioned that Patterson is getting their own share of the funding for rental assistance. Are we collaborating with them in any way to make sure there's not an overlap of services between the county and the city of Patterson?
The short answer is yes, we are. That doesn't mean there's not some logistics still to work through, but yes.
And Patterson's the only town in Passaic County that got their own funding? No, Passaic, Clifton, and Wayne, I think got some money as well, but maybe I'll let someone else speak to that.
You had all those towns listed as receiving their own, so you just reiterated what you had on the slide.
Yeah.
Well, That's not how, okay, I must have read it the wrong way.
I'm not sure those counties are going to be doing rental relief. I mean, excuse me, those municipalities, although Patterson has been and will be. But those other three, I don't know, are doing rental relief at this point.
Yeah, I know that they're the top four that need help with rental relief. I thought Patterson was the only one that was getting its own funding, that you had listed the other three towns as needing, you know, if there was a need.
I don't have the answer to that. If I may, that slide that Al showed was the top four in terms of corporate landlords who are on the docket for landlord tenant court.
Yes.
It's safe to say that every municipality, all 16 municipalities, have people in need.
Yes.
Those are also the four.
For sake of that slide, he picked the top four towns who have, again, corporate landlords. The
Okay,
mom
but
and pops who have not necessarily faced this situation before, because this is a pandemic and none of us have faced this situation before. Typically they don't know the system. And as you recall, the state of New Jersey put a moratorium on evicting people. So there are many landlords out there that we believe have not filed because they didn't think that they could, right? It doesn't prevent them from filing. It just prevents an eviction. But we believe that there are many more out there that haven't filed that could have filed and ultimately will once the moratorium gets lifted.
So I did get some clarity on the question that you asked, Commissioner Lazaro. Those four municipalities are receiving what is called CD3 money from CDBG grant that is, again, through economic development for the county. So all four are receiving them. The one, Patterson, has decided they're going to use some of their funds for rental relief. We are coordinating with them. We're actually coordinating well with them. Again, there's still, we have to work details out because we're just now getting our program up and going. But the other three have not yet said that they're going to use the money they're getting from CDBG for rental relief. So that's where we're at.
okay, yeah,
So
that was my
they
question.
did get money.
Okay,
Right.
that was my question.
Yeah, and that's consistent. This is for Commissioner Bartlett. That's consistent with the fact that, this is all CARES Act. Other than the CDBG funding that Albert mentioned, this is all CARES Act funding. So this is money that came to the county, and we allocated a portion of it down to municipalities. But programs like this, we're funding. The question that this board is going to face sometime later this year, as Albert pointed out, is of the additional funding that we're getting through the American Rescue Plan, do we want to allocate a portion of that, and or do we want to work with and persuade our municipal partners to allocate a portion of their direct American Rescue Plan funding to this program? And what we're hoping as we roll this out in the weeks ahead is to have it work, to get through that 13.5 million or so that we have on hand right now, and hopefully A, show that it works, B, provide some relief, and C, give this board a sense of what additional funding would help further protect folks from eviction in Passaic County in the second half of this year.
Yep. We're thrilled with how the community and our partners in the community are rallying together. I couldn't be more thrilled with how the court group that I'd mentioned is working. It is really heartening to see this, and this whole wraparound approach is not being done piecemeal. That's the best part of this, is that we're doing it in a coordinated, collective impact fashion, as opposed to other county, and this is not negative on any other county, but they're going to do the rental relief, and then one other department says yes, and we need to help with this, and somebody else in town says yes, we need to help with this, but it won't be coordinated in a way that is effective and efficient, as effective and efficient as this approach.
So let me just ask presentation, and I think we all understand the critical need for this. What is our timeline? Maybe I missed it, but
Yes.
what is our timeline?
Yeah, we hope we hope that by the end of this month, we open this up for people to apply. And our vendor is doing the modifications they need to do to add the wraparound piece to this and the screening questions that will get more support to residents. The moratorium on evictions is scheduled, I believe, June 17th to go out at this point unless it changes. That's the earliest that anyone could potentially be moved on. So we're expecting Solix to be ready to go by the end of April. I just can't give an exact date yet.
So I appreciate that, and it certainly makes a lot of sense for the folks who may be losing, where they live or lose, or right now, obviously because a lot of situations out of their control. But on the landlord side, I'm a little lost in terms of how do we? There's a lot of landlords who approach me who are folks who they just they own basically what is equivalent to a medium or small size business, and we don't look at them sympathetically, and I understand why we would not want to evict folks, absolutely. But when you're any business, if you're receiving $0 for the month and you have expenses to pay like the mortgage, that can be crippling. It is something we need to address. So how does this work with a landlord, like for say, who has a few units in Passaic County? How do they get involved in this process?
Yeah, they will have access to the portal. There will be documentation needed for each of their lessees. They will then any of the rental arrears that is given through this program is going to go to landlords.
Direct.
Not to the though renters can apply, and we hope they do. Renters are going to have to provide a certain number of documentation as outlined by the U.S. Treasury, and it's basic. It's not overly onerous for them to do this. And so the landlord has the motivation to work with their renters to get that documentation in. So yes, this is ultimately going to help landlords, but it's going to also, we're going to make sure that landlords, when they get help, sign they sign that they are not evicting for a period of time. And Commissioner Bartlett, I don't know if we've decided exactly what that length of time is yet, but we're really close. Do you have anything else to add to that?
Just that, Assad, you've identified exactly the problem, which is with the moratorium in place, it's the landlords, not the tenants, that are really motivated right now to participate in a program like this. So one of the things Albert and I did when we were on a conference with Solix last week was we emphasized there needs to be that tenant intake portal that they're used to building, but there also needs to be a landlord intake portal. That collaboration, that communication that Albert talked about is going to be essential, because this is a means tested benefit. This is something that the tenant is going to have to prove their income level so as to show that they're eligible for it. But we want to be able to get those landlords, particularly ones like you're talking about that own a few units, or somebody who owns a 2 or 3 family house, lives in one level and rents the others. All of those landlords are the ones that are struggling very much right now, and we want to make sure that that we can have a landlord-driven intake process so they can get it started. We can get money into their pockets, potentially even before the moratorium's lifted in June or later than June if the governor extends the state of emergency beyond the end of April.
Director, this is Commissioner Duffy. What a great program. Gives a lot of hope to some of the small people. Commissioner Bartley, you were just talking about that. People live in the 3-family houses and they have to. It's so bright light. I commend you, all of you.
Thank you.
Albert, you mentioned earlier about around June 17th, where, if I understood you correctly, the moratorium will be lifted.
Well, that's where it's currently scheduled, I believe. But that doesn't mean that's going to be when it's lifted.
Well, going under the assumption that that's when it's going to be lifted, does that mean that the eviction process starts at that point, at that
Yeah.
date?
I'll let Commissioner Bartlett respond.
Okay, without getting too deep into the law, that's the moment that the cork comes out of the top of the bottle. We've got, as Albert mentioned, about 5,000 pending court cases skewed very heavily towards those large corporate landlords. We've got probably thousands of more skewed towards the mom and pops that haven't even been filed yet. So the court is going to be dealing with those evictions, sort of going back to the earliest docket numbers and working their way forward, just like all of us in litigation are seeing the old cases get moved and then the new cases get moved. We're hoping to create a situation with this program ultimately where landlords and tenants don't even have to go through the court process to take advantage of this relief funding. But a big part of the early tranche of this, and a big part of the people that we can really identify right now as having the need and being good customers for this program, are the ones where those court cases are already pending. But back at the beginning of the state of emergency, the governor and the CDC hit the pause button. Once we hit that pause button again, and the movie starts to play, the old cases are going to move. New cases are going to get filed. I think a lot of new cases are going to get filed, which is why we're trying to get out ahead of it.
The reason I asked the question, John, is because if it's going to, I'm not aware of the time frame that it takes, the whole eviction process through the courts. I don't know if it takes a month, 6 months, 8 months, but the longer it takes, especially to the mom and pop landlords, they fall deeper into the hole. So you're kind of chasing your tail at that point, unless you can mitigate these cases quickly. That was the point of my question.
Right.
We're hoping to push this funding out as quickly as we can do the evaluation and the processing. And then, as Albert pointed out, and Bruce was talking about, we've got this set of wraparound services to work with the tenants on follow-up. Because, just because the state of emergency's ended doesn't mean every tenant we're dealing with suddenly has a job again. That whole set of challenges is going to continue forward. But you're absolutely right, Pat. This is something we need to move quickly, and I think our team has been trying very hard to do that.
Right.
And also, we should keep in mind that some of the backlog in landlord tenant are commercial properties as well, which this program will not address. Right? This program is going to be for residential landlords and tenants. Some of that backlog, but I will tell you, the backlog is tremendous. In my last conversation with Judge Capicella, normally there's one judge that handles landlord tenant. When this thing, when the moratorium gets lifted, he will probably have 8, 10, maybe 12 judges strictly doing landlord tenant to get the backlog caught up. So our hopes is to be ahead of that, right? Obviously, to me, it's a win-win-win, right? We're helping tenants stay in their homes. We're helping landlords collect rents that are due, and we're helping the courts relieve, what essentially is going to be a huge backlog for them. So I think it's really a win-win-win.
Yeah, absolutely. And remember, all those landlords, particularly the mom and pops, very often also have a mortgage. So eviction prevention is foreclosure prevention. And the more we can stay ahead of that, the better.
Yep.
Great point, John.
Yep.
Very good. Well, listen, Commissioner Bartlett, I just want to commend you and Albert for the work that you're doing. It's great work. It's difficult work. It's hard work, but I'm just glad that we have two individuals like yourselves at the head of this operation here.
Well, thank you. And just to add, I mentioned the court group, but there's been the Janus team and the Department of Human Services has been very engaged with this whole process as well. We've got some good people working in that department and with the team. So, but yes, thank you for that, Commissioner Lepore.
Albert, to be commended. Again, the holistic approach, I think, once again, is going to set Passaic County apart from other counties in the state of New Jersey. Try to get at the root cause of, right? It's not just throwing money at people. No good is going to come of just paying back rent if the tenant still doesn't have a job, or other issues that are causing him to or her to be in arrears of rent. So I think the holistic approach is really the right way to do it. And Albert and his entire team, Tom and Gina and Ron and Mr. Pursley have really done a great job putting this program together, as well as Francine Vince and her staff in Human Services. It's been a collective effort, and all three members of the Human Services Committee, Commissioners Bartlett, James, and Lazara have been very supportive of this throughout. So I think it's exciting. I think, again, other counties are going to look at Passaic County, look at our model, and really model their programs after ours. And I've already had a couple of calls. And I also want to thank Judge Capicella, who is always a great partner in what we do here in Passaic County from the judiciary side. He was immediately, when we approached him with the idea of getting access to the docket of landlord-tenant, there was no hurdles. He was ready, willing, and able to assist us in getting us that information so that we could be proactive and reach out to them, because obviously that's a great place to start.
Great.
All right. If there is nothing else, we will move on to Al. Thank you again for taking the time, and your team. We appreciate it.
My pleasure. Thank you.
All right. And then second on my agenda, director, of course, is Dr. Gungil, who is with us here, who is going to give us a update on our COVID-19 response here in Passaic County. Dr. Gungil, thank you.
Thank you. Whenever Mike is ready. All right, so this is my bi-monthly report. As of today, actually, we now have 61,151 cases have had in Passaic County, and we've also had 3 new deaths. So the death number has actually gone up a little bit more than what you're seeing there. But on this slide, you can see that the case fatality rate in Passaic County and New Jersey are the same. They've actually gone down 0.1% from last month. And when you look at the U.S. in general, the case fatality rate is less, and obviously similar to the world because of the larger population. Next slide, please. All right, this is hopefully the last time I'm going to put this slide up. This is just showing that we're still one of the top in number of raw cases, but thankfully there are others who are exceeding us, and we are actually moving down. So I'm hoping that in 2 weeks from today, I will not have this slide, because if we're number 8, I'm just, looking for us to go to the bottom of this particular pile. Next slide, please. However, we still have that high cumulative incidence rate, and though others are, pretty close, it's just a piece of data that we can't seem to shed. So again, we'll continue to look at this, even as our number of raw cases are declining in comparison to some other counties. Again, we still are, in not a great place with this particular data point. Next slide, please. All right, so it's day 395. You are probably hearing a lot about the variants. In New Jersey, there are several hundred variants, but in Passaic County, we have 22 cases of COVID-19 that are of the UK variant. Since March 23rd till today, we've identified 12 more cases of the UK variant in Passaic County. Also, okay, next slide, please. All right, so again, since the last meeting, we have added 51, and today 3 more cases, 3 more deaths in Passaic County. So unfortunately, people are still dying of COVID-19, and people are still being hospitalized by the second bullet point. The one piece of data on this slide that is very encouraging is that over the last month, we have not had another case of the multi-system inflammatory syndrome in children. So that's good. It means that perhaps we will start seeing a lower number of cases of this particular thing. Next slide, please. This is the epi curve for Passaic County. And you've been seeing it for over a year now. It's just to give you a visual in one picture. And each of these data points represent 1 week of cases. The next slide, please. All right, so this is an attempt. I asked my epidemiologist to put this together to compare what's going on with COVID-19 and the flu season. And on your left, you see flu activity level, which throughout the state is low, which is great, which is where we want it to be. And on the right of that, you see the COVID activity level, and throughout the state, it is high. In every single region of the state, it is high. These data are provided by the State Department of Health weekly. On the left, this is the graph at the bottom is a comparison of flu over the years. The last one, the red line represents the 2020-2021 flu season. So, it started to look like what it normally looks like, but really, in comparison to where we were last year, it's really doing pretty well. And you can see the high peak last year for influenza and pneumonia. And to the right of that at the bottom, under COVID, you can see the death due to COVID in Passaic County. So all things being equal, and this is a different slide that I really wanted to look at, which was to compare death rates. And this doesn't really do it the way I wanted it to, but maybe I'll work on that for the next one. Next slide, please. All right, so this is the percent positivity as of the last 7 days. And again, you can see that the percent positivity is lower. However, I want you to also notice that it is now hovering around 10 for quite a while now, from since November to now. And that's concerning because it could mean that COVID-19 will be endemic in the population, which means it's always present at a lower level. So, I was hoping, we were all hoping that that number will be lower, closer to 0, but that's not the case. So if that kind of trend continues, then we can expect that COVID is probably going to be one of the existing viruses that we have to be vaccinated against every year. But I don't know that yet. It's just looking at the trend. Next slide, please. All right, so this slide looks at Passaic County data based on race, ethnicity, gender, and age. And the pie chart on the left shows you that 45% of Passaic County residents who tested positive self-identified as Hispanic, 27% self-identified as non-Hispanic white, and there's that 17% of non-Hispanic. And that's that other that we always have to contend with here in Passaic County. On the far right, the bar graph is very interesting because it shows that in almost every age range, we have a substantial number of cases. And you could see 0 to 17 is pretty high. And the concern there is that children might be asymptomatic, and so they could be huge spreaders of COVID-19. but you could see that COVID-19 has affected every single decile of our population. So every 10 years, every 20 years, everyone is affected by COVID-19. Next slide, please. All right, so this is looking a little bit at the hospital data for the northern region. And I think perhaps the most important piece of data on this, and let me just back up. We always know that the real concern, the big concern with COVID-19 and any of these types of epidemic, pandemic, is how is it affecting our hospitals? Because hospitals have a lot of impact in our communities. So if people are in the hospital for COVID-19, therefore people who are, in cardiac arrest, women giving birth, all kinds of other things are being affected because of the use of beds or ventilators or whatever. So it's a piece of data that we're always looking at. And so looking at that as of yesterday, when I received my report, it showed that 58% of ventilators are being used, but however, ventilators in use by COVID-19, I don't have the number, but it was a very small number in comparison to probably 1/3 in use by COVID-19 patients when compared with other non-COVID-19 patients. So it's a good thing that we still have about 42%, about half of the ventilators that are available are not in use. So even though the hospitals are impacted, they're not overwhelmed at this point. And this is the northern, I think it's about maybe 12 or more hospitals in the northern region. Yeah. So the other one, you can see what it is in terms of discharges and so on for this past day or yesterday. Next slide, please. As you know, long-term care facilities have been impacted, and we are still seeing outbreaks in our long-term care facilities. Again, we continue to see staff cases. The cases are high. We're always concerned about that because of the potential for spread, because many staff members work in more than one facility, and also even if they do work in one facility, they go into more than one room. So it always is a concern because it affects our residents. And you could see that to the last column, the cumulative outbreak column, you could see the resident deaths being that high in comparison to the staff cases, even though the staff cases are pretty high as well. Next slide, please. All right, that's just to show you the at-home testing continues. And we've never stopped testing because that's still an important tool in the toolkit in our response. When residents continue to lead with their use of the at-home testing program. Next slide, please. Next slide, please. This is just what it looks like in terms of demand for our tests. And the demand is pretty low right now. Next slide, please. All right, so this is the vaccination clinic that we run in Passaic County. Your very left of that is, you can see that we have administered over 40,000 vaccines. And of that, 16,420 individuals are fully vaccinated. And that is a combination of J&J as well as Moderna. We actually have a clinic going on today. It might have just ended, hopefully, where probably about 1,000 people are going to receive their second dose and another 1,000 their first dose. All right, the center graph is one that I'm pretty proud of because it shows that the most vulnerable and the people who are in that first 1A category are getting vaccinated in our clinic. So you can see that the people who are 65 and above far outnumber the others in terms of getting their vaccine. So, we're doing the right thing. Now, obviously, I'm not sure if it's obvious, but for others who have received the vaccine at a younger age, there could be, underlying medical conditions, there could be healthcare workers, other essential workers. But even with that, you can see that we're actually reaching our target population, our seniors. And to the far right, you can see the breakdown by gender. More women, but it's 56 and 44 is neither here nor there. So,
Before you move on to the next slide, I just want to mention that this board should be very proud of the fact, and I think one of the reasons why you see the 65 and older age group much higher than the rest is the health department has kept an ongoing list of senior citizens who can't manipulate the website or get on the website. Some of them can get on the website, but they can't move fast enough to get an appointment. So we have every week set aside vaccines, and we reach out to that list. And there were 2,000 more people were added to the list than taken off the list. But we have done a great job of getting through that list and helping seniors who had difficulty getting appointments, and actually reaching out to them over the phone. And Vault Health, our partner, has been fantastic in doing that. So, I don't think that is happening by accident. I think is the point of what I'm trying to say here, is that we've made a conscious effort to try to get to that senior population.
Yeah. Yes, we have. Okay, next slide, please. All right, so this part of the report is specific again to our clinic, and this is who by race and by ethnicity, how people self-identify as using our clinic. Next slide, please. Could you just go back? I'm sorry, I wanted to make a point. Yes. So under race, you can see 74% of our residents self-identify as white, 8.2 prefer not to specify, 7.4 other race, 3.5 for Black or African American. There is a program or it's a target population for whatever reason. It could be vaccine hesitancy, it could be access to the internet, or as Mr. DeNova pointed out with the seniors, it could be even if there is access, they may not be able to navigate to get the appointment. And we're seeing that all over. But I'm just going to say that we actually went up a 0.1 percentage point. So we're trying to move the bar. We're talking to our faith-based partners to try to have that discussion about the safety and efficacy of the vaccines, and hopefully we'll see that move a little bit more by the next time we report. Next slide, please. All right, so another piece of good news is that we really try hard to reach Passaic County residents. And so from our clinic, 82% of people that we serve are Passaic County residents. So I know that in a lot of places, they're serving a lot of other people who are not part of their population, but I'm proud to say that we are. And that doesn't even take into account the fact that many of our staff live outside Passaic County. So even with that, we are still reaching the residents of Passaic County. And I'm proud of this slide as well. Next slide, please. All right, so as of today, actually, this is taken from the state website, and they're showing that in Passaic County, all of the people, all of the companies, all of the agents, healthcare providers that provide vaccines for COVID-19, a total of 254,000 plus vaccines have been administered. And of that, 101,087 people are fully vaccinated against COVID-19. So that's a huge thing because we're well on our way. As the next slide will show you, Micah. Next slide. No, it's going to be one further down. This is the breakdown by ethnicity in Passaic County. 2 slides ago, I showed you the breakdown by race and ethnicity for our clinic. This particular one is for all the clinics combined. And for this one, you can see again, the Black population has increased in in numbers. The Hispanic, Latino, or Latinx population is really, we're actually making some inroads into that population for getting the vaccine. Again, we still continue to have a high percentage of other or unknown. Um, the state's target for other is less than 20%, but unfortunately, we have both other and unknown taking it to 25%. So we'd really like that to go down some more. Next slide, please. Next slide, please. All right, so this is the breakdown. Again, we received this information from the state, and this is a nice slide as well because it shows us how each municipality in Passaic County is doing. So if you look at the third column, it shows the courses that are complete of the percentage of the adult population. So there's the population, then there is the adult population who is our target for getting the vaccine. And so if you pick Bloomingdale, for example, 20% of the adult population in Bloomingdale have been have completed their vaccine. So that's a big thing, right? You could see it for every municipality. Let's go down to West Milford, 17%, Woodland Park, 23%. Unfortunately, we still need to do some work with Passaic City at 8%. And that is even though there are 3 clinics that I know of that are run by the municipality in collaboration with St. Mary's, there is still a dearth of vaccines that people are getting in Passaic City. Hopefully, with the new FEMA program that was announced today, we will start seeing an increase in residents of Passaic City receiving their full course of vaccines. Okay, we still have some work to do with Hilden because they're at 12% of completing the course of the vaccine. But you know, every little bit helps, and we're getting there. Next slide, please. So this is the slide I thought was earlier. And this is just, you know, it just shows you where we are in the process. So with over 100,000 people vaccinated, it's approximately 38% of where we're trying to be. And I think that this is very encouraging because, you know, we're really starting to see some progress. I do believe we're going to get to our goal. It just takes some determination and some initiative and innovation to try to reach people where they are to get to what they need. Next slide, please. All right, I put this slide in there just as a comparison between the 3 vaccines because right now these 3 vaccines, except the Johnson & Johnson now, are being administered in our community. If you have not yet seen it, you'll see it soon, but there was a press conference today regarding a partnership and collaboration with St. Joe's, with St. Mary's, the city of Patterson, Passaic County, with a FEMA initiative where we are targeting, I believe it's 12 or 13 zip codes in Passaic County where the numbers of persons who are vaccinated are low, and there are a lot of other reasons, but FEMA is providing almost 5,000 vaccines to be administered in Passaic County, targeting Passaic County residents, but specifically of certain zip codes. So they're actively doing this in our community. So I just wanted to put this on the screen so you can have an idea of what's going on. Obviously, an asterisk with the Johnson & Johnson, as you perhaps know, this was paused today. And so we have paused our administration as we're required to do because of the reports that you're hearing. And I'll talk about that in the next slide. But mostly we've been vaccinating with Moderna. And you can see that 2 weeks after the administration of the second dose, we expect over 94% efficacy with that. And that's the bulk of the vaccines that we've been administering so far. Next
Dr.
slide.
Gungill, just as a little public service announcement, the number, if people in the appropriate zip codes in Patterson, Passaic, and parts of Prospect Park and Heldon, if they want to get the Pfizer vaccine through this FEMA program, they should call St. Joe's at 973-910-2502. It's 973-910-2502. Be the number to call for an appointment.
Okay, next slide, please. I think this was it. So because this was in the news this morning all day long, I just wanted to make sure that I address this this issue. So all we know is that we were told, we were asked by the Commissioner of Health to pause all of our administration of the Johnson & Johnson vaccine, and that we needed to label the vaccines that we have saying do not use and to put it aside. And we were told this because 6 women have been, I guess, diagnosed. I'm going to read this here. That 6 women between the ages of 18 and 48 experienced symptoms which occurred 6 to 13 days after vaccination, which consisted of a type of blood clot called cerebral venous sinus thrombosis in combination with low levels of blood platelets. Because of this, the CDC and the FDA are having convening a meeting tomorrow of the Advisory Committee on Immunization Practices. And that committee is going to review all of the cases and assess their potential significance. And as a result of that, they are going to let us know what will be next. That's basically all the information we have to stop using it, and that there's a big meeting tomorrow, and based on that, they will let us know what comes next. The CDC is going to have a media briefing, and I guess they're going to answer all the questions regarding this, but that's all we know. In the meantime, during our clinics, as you all know by now, we do have an observation area where we have physicians and nurse practitioners pay attention and observe individuals who receive their vaccines, regardless of which vaccine it is. You know, we also have individuals sign a consent form saying that they will receive this emergency use authorization vaccine. Currently, all I can say is that we've paused and we will await further guidance from the CDC and the Department of Health. Next slide, please. And there's Dr. Pruden again. But this slide is also to tell you that as of next Monday, everyone will be eligible for the vaccine. Now, this slide says age 16 and older. Just remember that the vaccines that Passaic County is administering as a county is the ones that you're required to be 18 and older. The Pfizer vaccine, which is being done with the FEMA program at St. Joe's, also at the Hani Awadallah School, they're using the Pfizer vaccine, and individuals age 16 and older can get it. But between 16 and 18, you will need to have a parent with you to give their consent for this medical procedure to be done. Thank you. Next slide. Thank you, and that is the end.
Okay.
Are there any questions for Dr. Gungil? If there are none, that concludes the administrative report.
All right. Thank you, Dr. Gunghill, for another comprehensive report. And again, for your tireless efforts to make sure that residents of Passaic County get vaccinated. Okay, moving on. Is there any commissioner who has a report to give? Speak now.
Director,
Yep.
Director, if I could just, I just want to briefly say Ramadan Mubarak to and Ramadan Kareem to the Muslim American residents of Passaic County and statewide. It is the first day of fasting today and Ramadan, and will continue for the month. And very grateful to the communities in Passaic County that have lighted a lantern or had a ceremony to recognize Ramadan. Despite all the the difficulties we have right now, there's at least 4 communities in Passaic County, including Woodland Park, which did it for the first time this year, that have recognized that, and I am grateful for that as a Muslim American myself, and as someone who grew up in New Jersey. We didn't have any of this when I was growing up. You feel different, and you feel someone of the other. So I'm grateful that the young people in our community in Passaic County, that they won't feel that way, I hope, and that they'll have a piece of themselves that they'll see in our our public squares. So thank you for that, Director.
Okay, thank you.
Director, very briefly, if I may, I joined County Commissioner Octor in extending Ramadan greetings to everyone. April is also Autism Awareness Month, and every year, with the exception of last year, Passaic County hosts a program of some sort to help families affected by autism. This year, it is coming up on Monday, the 26th, in conjunction with an organization in Clifton called Clifton Praise and our Disability Advisory Committee here in Passaic County, hosting a program about guardianship and financial planning for families with children or adult children affected by autism and other disabilities. I think if the last year and a half has given us anything to think about, it is preparing for our own eventual departure from this good earth, and the opportunity to be ready for that and to prepare financially for the needs of a disabled adult child is a big part of that. So information is on Passaic County social media channels about that program. You can register with Clifton Praise, get a Zoom link, and that's coming up on the 26th of April at 7 p.m.
Thank you, Commissioner. Anyone else? Okay. There are no communications. At this time, I'll take a motion to open the public portion of the meeting.
So moved.
Moved by Commissioner Duffy,
Second.
second by Commissioner Octor. Roll call.
County Commissioners Octor,
Yes.
Bartlett,
Yes.
Best,
Yes.
Duffy,
Yes.
Lazara, Deputy Director James,
Yes.
Director Lapore.
Yes, and I'll turn it over to you, Lou, because you have all that information in front of you there.
Okay. Director, we have, I believe, 2 people waiting in WebEx to make comments. We have Melissa Ray Lambert. Can you unmute Melissa Ray Lambert, please, Micah?
Ma'am, you are unmuted and you should be able to speak.
Thank you. I'm not sure what the protocol is, so apologies there. My name is Melissa Lambert. I live in Hawthorne, New Jersey, and just want to quick say thank you for the COVID testing at home and for the mega site on Route 46. I've used both, and they were very simple, very well organized, and I'm very appreciative. Then I'm calling because I live very close to Golflebrook Park. And you've done over the last few years, there have been magnificent improvements to the park and the entire town appreciates it. Most recently, however, there's a fence that is going up along Golfley Road. And it's causing a great deal of concern among the residents. There are a number of Facebook groups, discussion platforms, and a lot of people are sharing their concerns of cars trying to swerve when somebody stops and you can't swerve to the right anymore because the fence is right on the edge of the road. People have observed deer trying to get into the park and they're confused by the fence and they stop in the street, not knowing whether to jump over or go under. And I'm just wondering, what was the purpose of the fence and were there any studies done before the fence was installed?
Mrs. Lambert, the protocol is you would ask your question and then later on it'll be answered.
Okay, thank you very much.
Thank you.
Lou, you got another person?
Well, and there was also a Craig Cayetano.
Mr. Cayetano was on briefly, but he has since dropped out of the attendee list.
Anyone else? I move to close the public portion.
Motion made by Commissioner, I'm sorry.
And Director, just for the record, we did not receive any emails at public@PassaiCCountyNJ.org. We have not received any. So those are two ways that people can reach through to you.
Okay, I have a motion made by Commissioner Duffy.
I'll second Terry's motion.
Who seconded
That's Bruce James.
it? I'm sorry.
It's rough to understand my voice, but yeah.
Deputy Director James, you're usually very loud. You were very quiet there.
Next to you. I didn't want to yell.
County Commissioners Octor,
Yeah, yes.
Bartlett,
Yes.
Best,
Yes.
Duffy,
Yes.
Lazara, Deputy Director James,
Yes.
Director Lapore.
Yes. Anthony, you want to answer any of those or?
So there was no formal study done on the fencing, but we did have obviously our traffic engineer, Chuck Silverstein, go out and along with the Parks Department to survey the area and to guide them as to what the proper distance would be, which we did. We did have some complaints early on regarding some site visibility at Diamond Bridge and Warburton. We went back out there and Chuck's recommendation was to move some of the fencing back, which we did to help the site visibility. I know there's been some concern, and it's a concern for everybody. The reason that the fencing is put up was our way of prohibiting, there's no parking on Golfville Road there. Anyone who travels that during the summer months would know that people would tend to illegally park there. It was becoming a big problem. So the fence was our way of prohibiting parking there. There is enough room, according to Chuck, if there is someone that needs to be pulled over, whether it's a disabled vehicle or whether it's a traffic stop, there is enough room there. Obviously, not enough for the car to be fully out of the passing lane, but most roads there isn't a large shoulder, so it's not uncommon. Is the other issue I know that many people have had is deer. And whether deer would be confused or potentially injured or killed on Golf Road because of the fence. It's a 5-foot fence. Deer clearly can jump over it. There are some breaks within the fence, but I did want to make sure that is not an issue because it's a concern for everyone. I had Ken Simpson, our road supervisor, look into any obviously, it's a county road, so we get called if there's any dead deer in the road. There's only been one dead deer that we've picked up in 2021. And quite honestly, that was earlier in the year, late February, first week in March, I believe. So the fence wasn't even complete at that time, but it is something that we will continue to monitor moving forward. But if anyone, has a fence in the yard, which I do, and also have deer in the yard, which I do, know that no matter how hard you try, you don't keep the deer out. Again, I have a fence that I've watched deer many a time jump over the fence. Might it take a little bit of getting used to? Sure. But obviously our intent is not to cause any traffic concerns or any concerns for the wildlife either. So we will continually monitor that. But as I said, we did our due diligence in terms of our traffic engineer taking a look at it and where it needed to be placed. I don't know if there's any other questions, but that's all that I have.
Consent agenda, county council, do we have any late starters?
Yes, Director, there's one late starter and one amendment. The late starter I've marked as L77, which is a resolution amending the 2021 capital budget for the county of Passaic. The amendment is to L13, which is the resolution authorizing the reappointment of Robert A. Lyons as the County Emergency Management Coordinator for a 3-year term beginning June 1, 2021 and expiring May 31, 2024. It's just his term is incorrectly stated in the body of the resolution as June 1, 2018 to May 31, 2021. That just needs to be amended to reflect the correct term of appointment. There is no need for executive session. And just as my daily meeting reminder, if any commissioner has a resolution that they would like removed from the consent agenda to be voted on individually, please make that motion now through you.
Through you, Director, I would like to make a motion to pull L12 off the agenda for an independent vote.
Very good. All right, then I'll make a motion to amend L7, to add L77, which amends the 2021 capital budget. And also amendment L13 to correct the dates of appointment of Director Lyons as the County Emergency Coordinator. Need a motion?
Can I ask a question through the chair?
Okay.
Do we have to do Sandy's first since we're going to be voting on this?
I'm not sure it matters which order you do them in.
Well, we're going to be voting on the whole consent agenda, so it's a little confusing if we don't pull that.
Not
Well,
that we add an amend.
The director was looking for, a resolution to amend.
Oh, I'm sorry.
To add L77, and then before we vote on the consent agenda, Commissioner Lazar can make her motion to remove 12, I believe it was.
Gotcha.
Okay, so we're going to vote on the L12 first.
I'll move the addition and the amendment.
Okay, we have moved by Commissioner Bartlett,
I'll second that. Thanks, John.
second by Deputy Director James. Roll call.
County Commissioners Actor,
Yes.
Bartlett,
Yes.
Best,
Yes.
Duffy,
Ask you something to be clear. So we're voting on L12 right now?
No,
No.
We're voting to include this.
We're voting to add L77 and to amend L13.
Yes.
Yes.
Lazara,
Yes.
Deputy Director James, Director Lapore,
yes.
So
Take
now-
a motion. Take a motion to vote on L12.
No, excuse me, Director. Now we need a motion to remove L12 from the consent agenda.
Oh, all right, I skipped that step. Take a motion to remove L12 to be voted on separately, correct?
I'll make that motion, Pat.
Motion made by Deputy Director James,
Second.
second by Commissioner Bartlett, I believe. Roll call.
County Commissioners Actor,
Yes.
Bartlett,
Yes.
Best, Duffy,
Yes.
Lazara,
Yes.
Deputy Director James,
Yes.
Yes.
Director Lapore,
Yes.
Now, Director, it's at your discretion. We can either vote on the amended consent agenda or on L12.
Let's vote on the amended consent agenda first, and then we'll vote on L12. So I'll take a motion on the amended consent agenda.
Director,
Yes.
just so we're clear, it's L1 through L11 and L13 through L77.
Yes.
I'll move that.
Moved by Deputy Director James,
Second, Duffy.
second by Commissioner Duffy. Roll call.
County Commissioners Actor,
Yes.
Bartlett,
Yes.
Best,
Yes.
Duffy,
Yes.
Yes.
Lazara,
Yes.
Deputy Director James,
Yes.
Director Lapore,
Yes. Now we'll take a motion on L12.
I'll move that.
Moved by Deputy Director James,
Second.
second by Commissioner Lazara. Roll call.
County Commissioners Actor, I'm sorry. Yes?
Yes.
Okay. Bartlett,
Yes.
Best,
Yes.
Duffy,
No.
Lazara,
No.
Deputy Director James,
Yes.
Director Lapore.
Yes. Okay. And we're
The
going
resolution
to,
still passes.
Right.
correct. Under new business, receipt filed the supplemental debt statement from the CFO.
Correct. We are in receipt of it from the CFO.
Okay, second on new business, we have bond ordinance 2021-04. A bond ordinance providing for the acquisition of and payment of the purchase price for certain real property, including real property commonly known as 467-517 River Street in the city of Patterson, and improvements thereon by and in the county of Passaic, state of New Jersey, appropriating $20 million therefore, and authorizing $9 million in bonds or notes of the county to finance part of the costs thereof. Need a motion to approve bond ordinance 21-4 on first reading.
I'll move it.
Motion.
Moved by Deputy Director James. Second by, I think, Commissioner Duffy. Any other discussion? Roll call.
Director, if I may just, obviously, I think many, the commissioners know that this is the warehouse on River Street that houses our purchasing department, our board of, our superintendent of elections, our county superintendent of schools, as well as our warehouse for storage and our warehouse for voting machines. This building we have leased now for, before my tenure here, probably close to 20 years. The last lease, we negotiated a first right of refusal to purchase the property, which we are at that point now. There's been two appraisals, one by us, one by the owner, John Fressy at Bascom Corp. We have the sale price will be $18 million. The additional $2 million will be for some additional capital improvements that we'll need to make to the building that we have held off making because it wasn't in our best interest to do it before the purchase. But this is, I also want to add too that $11 million of the purchase price will be from cash that the county has on hand, and only $9 million will actually be money that we go out into the market to borrow.
Okay, any questions from the board? All right.
County Commissioners Actor,
Yes.
Bartlett,
Yes.
Best,
He's having some technical difficulties.
okay. Duffy,
Yes.
Lazara,
Yes.
Deputy Director James,
Yes.
Director Lapore,
Yes. Need a motion on personnel?
So just for the record, to be clear though, that Freeholder Best did not vote, correct? So
yeah,
it'll
but
be 6-0.
Freeholder Best, are you there?
Freeholder
Don't see
Best is not present in the WebEx right now.
All
Okay.
right. He did not vote, but it's 6-0.
Thank you.
Okay, I take a
All right,
motion.
on to the personnel agenda.
Motion made by Deputy Director James,
Second.
second by Commissioner Lazara. Roll call.
County Commissioners Actor, Bartlett,
Yes.
Duffy,
Yes.
Lazara,
Yes.
Deputy Director James,
Yes.
Director Lapore,
Yes. Motion on the bills?
I move the bills list.
Motion made by Deputy Director James,
Second.
second by Commissioner Lazara. Roll call.
County Commissioners Actor,
We're dropping
Bartlett,
like 5.
Gotta yell.
Yes.
Best, Duffy.
Yes.
Is Best back?
Yes, sir, Commissioner.
I'm back.
Best.
I got disconnected. Sorry.
Okay.
Yes.
Duffy, Lazara,
Yes.
Deputy Director James,
Yes.
Director Lapore.
Yes. At this time, I'd like to join my colleagues on this board wishing all a Ramadan Mubarak and have a safe and healthy day. Take a motion to adjourn.
Make that motion to adjourn.
Motion made by Commissioner Duffy. Second by Commissioner Bartlett. Roll call.
County Commissioners Actor, Bartlett,
Yes.
Best,
Yes.
Duffy, Lazara,
Yes.
Deputy Director James,
Yes.
Director Lapore.
Yes. Good evening, everyone.
Bye.
Hey, everybody, be safe.